Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Homeopathy. Now let us see the contraindications for myomectomy. Contraindications of myomectomy can be divided into two types. One is absolute contraindication where you should not be doing myomectomy, and the second one is called as a relative contraindication where it depends on the discretion of the surgeon who is performing it, or it depends upon the discretion of the gynecologist or the person who is performing it. So first absolute contradiction is pregnancy. You cannot perform a myomectomy while you're pregnant. Second one, if you have no desire for future fertility, that means you've already, you have planned certain amount of babies, like you have 2 babies, 3 babies, you've already finished that phase where you want to experience motherhood, and now you have fibroids and you have no desire for future pregnancy, then it is better option to go for hysterectomy than myomectomy according to your gynecologist or according to allopathy doctors. They would prefer you with a hysterectomy. Then the third one is suspected endometrial cancer. If you're someone who is suffering from carcinoma or cancerous conditions, then myomectomy is not for you. Then coming into the relative contraindications. First relative contraindication is large and numerous myomas. If the size of the leiomyoma, which is the other name for fibroid, is very big, or if there are very multiple n number of fibroids, it depends upon the discretion of the person who is performing the surgery to do it or to not do it. The second one is advanced PID, which is pelvic inflammatory disease. It is an absolute no in UAE, which is uterine artery embolization, whereas it is in the relative contraindication in myomectomy. If you're someone who's suffering from PID and it is like absolutely in a bad stage, then your gynecologist might not suggest you for a myomectomy. The third one is uterine size larger than 16 weeks. If you're pregnant and your uterine size, or you have passed the 16-week duration, then myomectomy is not for you. It's a contraindication. Coagulopathy disorders. What do you mean by coagulopathy disorders? If you're having coagulation disorders, if you're someone who has problem clotting the blood, or you're having bleeding time and clotting time are really very slow, then you have to first get treated for that coagulation problem and then go for a myomectomy, because after surgery, if you have a bleeding problem, the blood will start to ooze really fast and you will lose a lot of blood. You should be getting a blood transfusion after that. Fibroids in lower uterine segment and myomectomy during cesarean section. This is something that I need to explain with the help of a diagram. So let's just check it. As you can see here in the picture, this is the uterus, this is the cervix and the vaginal part. If you are having any sort of fibroid which is blocking the cervical or the vaginal region, okay, it usually blocks the cervical region, which is called as cervical leiomyomas or cervical fibroids. So what happens is that if you are someone who is pregnant and has a cervical leiomyoma or a fibroid which is blocking the cervical canal, you cannot do a normal NVD, which is normal vaginal delivery. So vaginal delivery is not possible. You have to get a C-section done. And during the C-section, after the removal of the baby, they can remove the fibroid also. So this depends upon the discretion of the surgeon who is performing it. So if you are having fibroid near the cervical region, you are absolutely not fit for normal vaginal delivery. So you have to get a C-section, and while the C-section is being performed, they can remove the fibroid as well. These are some of the relative contraindications for myomectomy. If you're viewing this video, if you're someone who is suffering from fibroids or any other female reproductive organ diseases, Fidicus Homeopathy is the answer. Here we have two kinds of consultation options, the one being online consultation and in-person or offline consultation. If you're staying near the nearest branch of Fidicus, you can come and consult us in person. If you're staying far away from us, you can consult us online through audio consultation option or through the video consultation option. After the consultation has been finished, we will ask you for needed investigations. If you have already done the investigations, you can share it with us. After doctor consultation and case taking, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. Apart from that, anywhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you want to contact us, you can call us on this number, WhatsApp us, or message us. If you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who is suffering from fibroids, endometriosis, adenomyosis, PCOS, PCOD, or if you're suffering from dysmenorrhea or any sort of female reproductive organ diseases, you can count on Fidicus Homeopathy, because Fidicus Homeopathy stands for highest chance of health. Here we are following 3 basic principles, the one being highest success rate. We are already treating these kinds of cases and we have really good success rate in them. The second one being the transparent treatment. Here there is no gray area between the patient and the doctor. The prognosis of your case will be clearly explained to you. And the third one being the personal care. And personal care here at Fidicus is top notch. Here we will be busting all your myths, we will be educating you on all your queries, and also we will be advising you on what to do and what not to do, like the precaution. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.